The sea can be a force of nature, beautiful and serene at times, yet unpredictable and unforgiving when conditions change. Every seafarer knows the risks that come with working in this vast environment. Among the most dangerous scenarios at sea is a man overboard. When a crew member, passenger, or even a visitor falls into the open water. In such moments, quick thinking, immediate action, and proper training can be the difference between a successful rescue and a tragic loss. The ocean does not wait, and neither can we. In this training session, we will take a deep dive into the fundamental and advanced aspects of shipboard water rescue operations. From recognizing an emergency to executing life-saving recovery procedures, you will learn essential skills to prepare yourself for real-life scenarios. This training covers for emergency response protocols on how to act quickly and effectively, ship maneuvering and rescue equipment usage for understanding essential tools, recovery techniques, and onboard medical care for ensuring survival post-rescue, real-life case studies and lessons learned, insights from past incidents. By the end of this session, you will have a complete understanding of how to conduct a successful water rescue operation with confidence and precision. Let's get started. A man overboard situation can occur in seconds. Slippery decks, unpredictable ship movements, or even high winds can cause someone to lose their footing and fall into the water. In rough seas, strong currents and waves can pull a person away from the ship faster than expected. If a crew member goes overboard, their survival depends on two things. First, how quickly they are spotted, and secondly, how efficiently the rescue team responds. Let's break down the immediate steps taken once an MOB emergency is identified. The first step in any rescue operation is to ensure that everyone on board is immediately aware of the emergency. The moment a person falls into the water, the nearest crew member must shout, "Man overboard," loudly and clearly. Press the MOB alarm button to alert the bridging crew. Throw a life buoy with an attached MOB marker to help track the victim's position. This ensures that all crew members and bridge officers can initiate response procedures without delay. The key is coordination. Every second wasted decreases the chances of a successful rescue. A ship cannot stop instantly. When a person falls overboard, the ship's size, speed, and environmental conditions all affect how quickly it can turn around and return to the person in distress. Unlike small boats, large vessels require careful maneuvering to ensure a safe and precise approach to the victim in the water. A poorly executed turn can result in losing sight of the victim, creating dangerous wake or delaying the rescue. The first step in ship maneuvering is to decide which turning method is best for the situation. In this segment, we will analyze the three primary rescue turns used by ships in man overboard emergencies and how to execute them effectively. The Williamson turn is one of the most commonly used maneuvers when a person falls overboard, especially at night or in poor visibility. This turn allows the ship to return to the exact same track it was traveling before the emergency. When to use the Williamson turn? In low visibility conditions, either nighttime or fog, when the ship has moved far from the MOB point, and if there is uncertainty about the person's exact location. How to perform the Williamson turn. Firstly, turn the rudder hard over 35 degrees to the side where the person fell overboard. Once the heading changes by 60 degrees, shift the rudder hard over to the opposite side. The ship will loop back onto its original course, returning to the exact MOB position. The advantage of the Williamson turn is its accuracy. It ensures that the ship returns directly to the location of the incident, increasing the chances of a successful rescue in low visibility. However, it takes more time compared to other turns. If the victim is clearly visible and the ship is traveling at lower speeds, a faster maneuver might be preferred. The Anderson turn is the fastest way to reach a person who has fallen overboard. It is most effective when the victim is clearly visible and the ship can react immediately. When to use the Anderson turn. The Anderson turn used when the person overboard is clearly visible, when the ship is moving at moderate speed, and when a fast recovery is necessary. How to perform the Anderson turn. Anderson turn performed by, firstly, turn the rudder hard over 35 degrees toward the MOB side. Then reduce engine power to slow the vessel. As the ship turns 250 degrees in a tight arc, straighten the rudder and the ship will quickly return to the MOB location. This method is faster than the Williamson turn, but is not ideal for rough weather or low visibility conditions, as it relies on the crew being able to maintain constant visual contact with the victim. Let's now examine a third method, which is used when the ship has already moved past the victim before action was taken. The Charnow turn is a maneuver used when the ship has already moved a significant distance beyond the person overboard. This method allows the ship to make a quick return without retracing the original course. When to use the Charnow turn. The Charnow turn used when the ship has traveled far beyond the MOB position, when the victim is out of immediate sight, but conditions are clear, and when a faster response is needed compared to the Williamson turn. How to perform the Charnow turn. The Charnow turn performed by turn the rudder hard over 35 degrees toward the MOB side, allow the ship's heading to change by 240 degrees, shift the rudder hard over to the opposite side, and the ship will return toward the MOB position along a new track. This method is faster than the Williamson turn, but is only useful when the ship has already moved far past the victim. Choosing the correct maneuver is critical. A delayed or incorrect turn can waste precious time and reduce the chances of a successful recovery. Now that we've reviewed all three turning maneuvers, let's compare them and determine which is best for different situations. Selecting the right turn depends on visibility, ship speed, and how far the ship has traveled past the victim. These decisions must be made quickly, with the captain and bridge team working together to execute the best possible maneuver. In the next segment, we will focus on hands-on rescue techniques once the ship is properly positioned near the victim. In any man overboard situation, knowing the proper rescue techniques is crucial for a safe and efficient recovery. Every second counts, and the method you use will depend on the victim's condition, location, and the ship's maneuverability. We will now walk through the 4 key water rescue methods used by professional maritime crews worldwide. Lifebuoy and throw. Line rescue is the quickest and safest for a conscious victim. Rescue boat approach is best for rough waters or unconscious victims. Rescue cradle outboarding ladder is used for bringing victims back on board. Direct contact rescue is used when the victim is too weak to assist themselves. Let's go through each method in detail. The lifebuoy and throwline rescue are one of the fastest and most effective ways to assist a person in the water, but it must be executed correctly. Throwing the buoy too short or too far can result in failure. Key lifebuoy. Throwing techniques. Always throw the buoy beyond the person, then pull it toward them. Ensure the rope is not tangled before throwing. Communicate clearly. Grab the lifebuoy and hold on. Keep pulling steadily until the victim is close to the ship. Accuracy and communication are critical. If your first throw misses, quickly retrieve the line and try again. Now let's see how the rescue boat is deployed when the lifebuoy method is not sufficient. In some cases, the victim may be too far from the ship, unconscious, or struggling in rough waters. This is when the fast rescue boat, FRB, is deployed. The FRB allows for a precise and controlled approach. Step-by-step FRB deployment. Step 1. The boat team is briefed before launch. Step 2. FRB is lowered with a winch system. Step 3. The team navigates carefully to avoid creating a strong wake. Step 4. One rescuer extends a floating line to secure the victim. If the victim is unconscious, 2 crew members pull them into the FRB. The key to an effective FRB rescue is approaching from downwind and maintaining a steady course. Too much speed or an incorrect angle can make it difficult to pull the victim on board. Now that we have retrieved the victim, let's examine how we safely bring them back onto the ship. Once the victim has been secured by either a lifebuoy, throw line, or rescue boat, the next challenge is bringing them back on board safely. Depending on the vessel's height, crew members will use either a rescue cradle, boarding ladder, or mechanical hoisting system. Methods for bringing the victim back aboard. Rescue cradle is a net-like structure that allows the victim to be lifted in a horizontal position, reducing injury risk. Boarding ladder is used if the victim is conscious and able to climb. Mechanical hoist is for unconscious or injured victims. For injured or exhausted victims, using a rescue cradle or mechanical hoist is the best option to prevent further harm. Always ensure the victim's head and neck are stabilized during the lift. In extreme cases, a rescuer may have to enter the water to assist the victim. Let's now examine the direct contact rescue method. In situations where the victim is unable to grab onto a lifebuoy or line, a direct contact rescue may be necessary. However, this method is only used as a last resort, as entering the water poses additional risks. Key techniques for direct water rescues. Approach slowly and from behind to avoid panicking the victim. Secure the victim's head and keep their airway above water. Use a cross-chest carry or underarm tow to bring them to the ship and never allow the victim to grab onto you directly, as they may pull you underwater. In real emergencies, these techniques can make the difference between a life saved and a life lost. Proper training and teamwork are essential for a successful rescue. Now, let's quickly review the key takeaways from our hands-on rescue training. Lifebuoy throwline rescue is the quickest and effective for a conscious victim. Fast rescue boat approach is used for long-distance or rough sea rescues. Rescue cradle and boarding ladder is essential for safely lifting the victim on board. Direct contact rescue is the only used when no other methods are possible. With these methods, ship crews can respond effectively to any man overboard situation, ensuring the highest chance of survival for the person in distress. Next, we'll cover post-rescue medical care, where we focus on first aid, CPR, and hypothermia treatment. Once a person has been recovered from the water, the rescue mission is not yet complete. Immediate medical attention is critical to ensure survival and prevent further complications. Even if the victim appears fine, prolonged exposure to cold water, exhaustion, and water inhalation can cause delayed health risks such as shock, hypothermia, or secondary drowning. Every crew member must be trained in basic first aid and emergency response procedures to stabilize the victim until professional medical care is available. This segment will cover the assessing the victim's condition immediately after rescue, identifying symptoms of shock, hypothermia, and water inhalation, administering first aid, CPR, and oxygen therapy, and carrying the victim for further medical treatment. Let's begin by examining the first and most crucial step. First, assessing the victim's condition. Immediately after recovery, a primary medical assessment must be conducted to determine the victim's condition and any immediate threats to their health. Step-by-step medical assessment. Check for consciousness, shake the person gently and ask, "Are you okay?" Check breathing, look for chest movement, listen for breath sounds, and feel for airflow. Check pulse, use 2 fingers to check for a pulse at the neck, carotid artery, or wrist. Look for injuries, examine for cuts, bruises, broken bones, or signs of head trauma. Observe for shock symptoms, weak pulse, pale skin, rapid breathing, or confusion. If the victim is unresponsive and not breathing, immediate CPR must be performed. If they are conscious but weak, further assessment will determine if they are suffering from hypothermia, water inhalation, or shock. One of the biggest risks after water immersion, especially in cold environments, is hypothermia. Even in tropical waters, prolonged exposure can reduce body temperature to dangerous levels, leading to confusion, unconsciousness, or even cardiac arrest. Recognizing hypothermia symptoms. First is mild hypothermia. The symptoms are shivering, confusion, cold skin. Second is moderate hypothermia. The symptoms, slurred speech, clumsiness, slow pulse. And finally is severe hypothermia with the symptoms like loss of consciousness, weak pulse, no shivering. Treatment for hypothermia. Number 1 is to remove wet clothing immediately and replace with dry blankets. Then keep the victim lying down and cover their body but not face. After that, apply warm compresses to the chest, armpits, and groin area. And finally, give warm, sweet liquids. If they are conscious, no caffeine or alcohol. In severe cases, a person with hypothermia may stop shivering and lose consciousness. This is a medical emergency requiring CPR and immediate evacuation to a hospital. Next, we'll examine another serious post-rescue risk: water inhalation and secondary drowning. If a person has inhaled seawater into their lungs, they are at risk of developing a condition known as secondary drowning, a potentially fatal situation that can occur hours after the rescue. Signs of water inhalation and secondary drowning. Number 1 is persistent coughing and difficulty breathing. Number 2 is foaming at the mouth, a sign of lung fluid buildup. Number 3 is chest pain or tightness when trying to breathe. And number 4 is extreme tiredness or dizziness, signs of reduced oxygen levels. Treatment for water inhalation. A. Keep the victim sitting upright to help breathing. B. Provide oxygen therapy if available. C. Monitor for delayed symptoms for at least 24 hours. D. Prepare for emergency medical evacuation if symptoms worsen. It's critical to monitor the victim. Even after they seem stable, a person may appear fine immediately after a water rescue but could develop breathing problems later. Medical evacuation may be necessary for further observation. If the rescued person is unresponsive and not breathing, immediate CPR, cardiopulmonary resuscitation, must be performed to restore circulation and oxygen supply to the brain. How to perform CPR on a drowning victim? Check for pulse and breathing. If no pulse, begin CPR 30 chest compressions followed by 2 rescue breaths. Use an automated external defibrillator, AED, if available. Continue CPR until the person regains consciousness or medical help arrives. How to provide oxygen therapy. 1. Connect an oxygen mask to an emergency oxygen tank. 2. Set the flow rate between 10-15 liters per minute for optimal delivery. 3. Ensure the mask covers both nose and mouth to assist breathing. CPR and oxygen therapy are life-saving measures that must be applied immediately in critical cases. Even after resuscitation, the victim must be taken to a hospital for further medical evaluation. Once the victim is stabilized, the final step is preparing them for further medical treatment on land. Depending on the severity of their condition, this may involve calling for helicopter or lifeboat evacuation, recording all medical actions in the ship's log, communicating with shore-based emergency teams. Every successful rescue is a result of fast action, teamwork, and medical preparedness. Understanding these procedures ensures the best chance of survival for anyone who falls overboard. Next, we'll review real-life case studies of shipboard water rescues and the lessons learned. Training and preparation are the foundation of every successful rescue operation. A well-trained crew that regularly practices emergency drills will be far more effective when facing a real man overboard situation. In this segment, we will conduct a full mob simulation drill, testing the crew's ability to respond immediately to a man overboard alarm, communicate effectively with the bridge and all departments, deploy lifebuoys, throw lines, and fast rescue boats, and perform a full victim recovery and medical response. Each crew member will take on a specific role, just as they would in a real-life emergency. Let's begin with the first phase, the emergency response. The first 60 seconds of any man overboard situation are critical. Every crew member must react immediately and follow the emergency response checklist without hesitation. Step-by-step emergency drill response. First, lookout reports man overboard to the bridge. Then, mob alarm is activated to alert all stations. Crew throws a life buoy with a marker to track the victim. Bridge slows the ship and prepares for maneuvering. A designated crew member maintains constant visual contact with the victim. Every movement must be coordinated and precise. Any delays or miscommunications can reduce the chances of a successful rescue. Now that the ship is slowing, let's begin maneuvering toward the victim. In a real MOB scenario, the bridge team must quickly determine the best maneuvering technique based on the ship's speed, weather conditions, and distance from the victim. Drill maneuver checklist. Confirm the victim's location and communicate with deck teams. Reduce engine speed. to prevent strong wake. Execute the Williamson turn to return to the MO position. Adjust speed and heading for optimal recovery. The Williamson turn is being used in this drill since it is ideal for returning to a specific point in the water. In cases where the victim is clearly visible, the crew may instead use an Anderson turn for a faster approach. As the ship moves into position, let's observe how the fast rescue boat team prepares for deployment. Now that the ship has successfully maneuvered, the next phase is deploying the fast rescue boat to recover the victim. This step is crucial in cases where the victim is too far from the ship or struggling to stay afloat. Rescue boat deployment steps. Step 1. Confirm weather and sea conditions before launch. Step 2. Crew members put on personal flotation devices, PFDs. Step 3. FRB is lowered carefully to avoid unnecessary wake. Step 4. Boat team establishes radio contact with the bridge. And final step is the rescuers approach the victim from downwind for stability. The rescue boat crew must approach slowly and from the downwind side to avoid pushing the victim further away. The rescuer in the boat uses a rescue sling to secure the victim before pulling them on board. Once the victim is safely secured, the boat team will return to the ship for a medical evaluation. A successful recovery is only the first step. Once the victim is back on board, they must be immediately assessed for breathing difficulties, shock, hypothermia, or injuries. Post-rescue medical checklist. Check airway, breathing, and pulse. Remove wet clothing and cover with dry blankets. Monitor for signs of water inhalation or secondary drowning. Administer oxygen therapy if necessary. All medical findings must be logged, and if the victim requires advanced treatment, arrangements should be made for emergency evacuation to shore-based medical facilities. Every training drill should conclude with a debriefing session where the crew evaluates what went well and what could be improved. Questions to ask in the debriefing. Did the emergency response happen fast enough? Were there any miscommunications during the drill? Did the rescue boat deploy smoothly and efficiently? What improvements can we make for next time? Regular training not only builds confidence, but also identifies areas for improvement. By refining our response time and teamwork, we ensure that if a real emergency occurs, we are fully prepared to act swiftly and effectively. Next, we move into the final segment of this training, reviewing real-life case studies of maritime rescues and their key takeaways. Throughout today's training, we have covered every critical step involved in the successful recovery of a person overboard. This training has been structured to ensure that all crew members understand their individual responsibilities and how their actions contribute to a successful rescue operation. Let's quickly go over the key takeaways from this training session. Key takeaways from each segment. Recognizing a man overboard, MOB. Immediate response is crucial and every second counts. Emergency reporting and communication. Clear, concise communication with the bridge and crew ensures a coordinated response. Ship maneuvering techniques. Choosing the right turn, Williamson, Anderson, or Charnow based on the situation. Rescue equipment and deployment. Effective use of lifebuoys, throw lines, and fast rescue boats. Hands-on rescue techniques. Safely retrieving conscious and unconscious victims. Medical assistance and post-rescue care. assessing for hypothermia, water inhalation, and secondary drowning risks, training drills, and continuous improvement. Regular practice improves response time, coordination, and survival rates. Mastering these skills is essential for every crew member. A well-prepared crew is the difference between a successful rescue and a tragic loss. Let's now discuss real-life examples where training made the difference. While we train in controlled environments, real-life emergencies are often unpredictable. Studying past men overboard incidents helps us learn from both successful rescues and cases where errors led to tragic outcomes. Case Study 1. Successful rescue at sea. A crew member fell overboard in rough seas at night. Immediate action. Taken by immediate activation of MOB procedures, successful Williamson turn, and well-coordinated FRB deployment. As the outcome, the crew member was rescued within 10 minutes with only mild hypothermia. Case Study 2. A lesson in communication failure. A deckhand fell overboard but was not immediately noticed due to poor visibility. Due to delayed reporting, lack of designated lookout, and miscommunication between crew members, and caused the search took over an hour, and the victim suffered from severe hypothermia before being rescued. Case Study 3. Coast Guard helicopter rescue. A passenger fell overboard from a cruise ship during stormy weather. Action taken by launching a fast rescue boat, but rough waves made recovery difficult. The Coast Guard was contacted and the helicopter rescue was performed. As lesson learned in extreme conditions, external assistance may be needed. Always coordinate with rescue authorities when necessary. Each of these case studies highlights the importance of immediate action, proper training, and clear communication. The more we learn from past experiences, the better prepared we will be for future incidents. Now, let's discuss ongoing training, certifications, and how you can stay prepared at all times. Training doesn't end here. Every crew member must continuously improve their knowledge and skills by participating in refresher courses, onboard drills, and industry certifications, recommended certifications and courses. STCW, Standards of Training, Certification, and Watchkeeping is mandatory for all seafarers. Advanced Sea Survival Training focuses on MOB recovery, life raft deployment, and distress signaling. First aid and CPR certification is crucial for onboard medical response and ISM code and safety drills to ensure compliance with international safety regulations. Regular participation in drills and safety training is not just a requirement, it's a responsibility. Being prepared means being ready to act with confidence and skill whenever an emergency occurs. Next, let's discuss how you can access more training resources and ensure you are always up to date with the latest safety practices. Your training should never stop. The more knowledge and experience you gain, the better prepared you'll be when facing real-life emergencies. If you found this training session useful, make sure to subscribe to our channel for more professional training videos. Watch more safety courses covering firefighting, emergency evacuations, and survival techniques. Like and share this video to help spread awareness among fellow seafarers. Every life saved at sea is a mission accomplished. Stay prepared, stay trained, and stay safe. Thank you for being part of this training. Until next time, fair winds and calm seas.